Thank you, Mayor. A couple of items I want to mention this morning. First, I want to introduce our employee of the quarter. I think I've told you previously we've started an effort to recognize city employees for their good performance, and we do that quarterly now. They are recognized based on their performance of their duties, customer service, and other objective criteria. And so with that, I would like to have Marianne Reedy stand up and be recognized. She is a Corpus Christi Employee of the Quarter. And I told her she wouldn't have to give a speech.
Who do you work with? Who does she work with?
The engineering services.
Great, thank you.
Yes, and she has been very active with the city CAT team, the employee assistant team, and other volunteer activities in addition to her regular duties.
Great,
so
thank
we're
you.
proud of the work she does. I wanted to tell the City Council that the American Institute of Architects has approved the RUDAT study for the general downtown area that we've talked about in our retreat and other meetings. We're pretty happy to get that news. I wanted to mention the most recent information on the oil spill that occurred here approximately a week ago. We've had people in cooperation with the General Land Office monitoring the effects of the oil spill on our beaches, and as of this morning, the report I received was that they basically got it cleaned up. There have been no reports of oil or tar balls or any negative effects. The General Land Office, we believe, has done a superior job of getting the cleanup completed in a relatively short time. So we're happy about the cleanup. We're sorry that we had to clean it up in the first place. I also wanted to make the council aware that we had applied for a grant in conjunction with rebuilding one of our marina piers, and we just got word that we have received a $502,000 grant from the State Parks and Wildlife organization. So while the replacement of the R pier was financially feasible for us to do without the grant, it's going to make it even more attractive having the grant. And then the last thing I wanted to mention before, I think it's the last thing, yes, before we turn the time to our health department for their performance report, was that you know that for the past year and a half, I've tried to hold some kind of an activity with city employees 2 or 3 times a year. For example, we've done a motorcycle ride on 2 occasions with city employees. We've had a beach party. We've done a kayaking event. And the next one that we will do will be on May the 10th. It will be an employee talent show. And so far we have, I think Steve told me we had 22 acts lined up for the talent show. It will be at the American Bank Center in the Salina Auditorium. And I want to make sure that City Council is invited and knows that you're all welcome to attend. I'm actually kind of looking forward to this. I think it's going to be a fun event, and it will be a different event. We're trying to create events that draw in different city employees with different interests so that it's applicable to everyone. Not everybody rides a motorcycle. Mm-hmm. But I think this is an event that can be a lot more inclusive, and I think it's going to be fun to see the kinds of talents that our people have. So I hope the council can think about that and attend with us.
Sounds great. Mr. Elson, will you be doing your Mick Jagger impersonation?
I will be the MC, and I'm not going to tell you what I'm going to do in conjunction with that. You'll have to come and be surprised.
Okay. That's a good tease. That's a good tease to bring people forward.
And now we'd like to turn the time to Annette Rodriguez and talk to us about the health department.
Thank you, Mr. Olson.
Thank you. I think we're all interested to see this.
If you can bring down the microphone,
We're
thank
all
you.
interested to see this talent that we all have. This one here, yes, it is. Okay. Good afternoon, Honorable Mayor and Council. Thank you for having me here. My name is Annette Rodriguez. I am the Health Director for our City County Health Department. Our mission is to assure the general health and physical well-being of our community. I'm going to start with our operational profile over to the right. It lists the 2 satellite clinics, one on Waldron Road in Flower Bluff and one on the Calderon building in Robstown. In addition to the main Horn Road site that we have 7 clinics that include the tuberculosis, sexually transmitted diseases, women, infant, and children program, the women's health services, the breast and cervical cancer and control program, immunizations, and our nurse-family partnership clinics. In addition to those clinics, we have a myriad of other services that we provide, such as environmental health, emergency preparedness, laboratory services, health education, and our healthy weight programs, which we have 2 of. One that encompasses working with city county staff to assist them in choosing healthier options, and the other is our childhood obesity program prevention program that you all are aware of. There are a total of 53 health departments in Texas, and 17 of those are health districts, such as ourselves, where we provide services not only to the city, but also the county as well. Only 19 of the 53 health departments in Texas were approved for 1115 waiver funding. So I'm going to move over to the baseline information, starting with the total expenditures. The additional expenditures noted in fiscal year 12-13 are due to increases in the comp plan and recently awarded Medicaid 1115 waiver seed funding. This 1115 waiver seed funding also impacts our increase in the number of FTEs, as you see there, from 106 to the 115. The number of health district county employees is 50 employees, and the number of health district city employees is 65 employees. If you look a little bit further down, the number of birth and death certificates issued, this number has been declining since the state changed the requirements for getting a passport. You're now required to have the long version of your birth certificate before you can purchase a passport. So we're starting to taper down from that time, since people have already, most of them have purchased their passports, those people that are going to travel. The city performance review is good at clearly delineating these types of historical trending patterns. The next line is the number of immunizations provided, which also shows a downward trend, especially from 09-10 of 42,288 vaccines that were administered. That was due to the H1N1 epidemic, and more people chose to have their flu vaccines then and in fiscal year 10-11 than currently, as the fear factor subsides from the year of the epidemic. Skipping down to the number of TB screenings conducted, you see a jump of around 12,000 TB skin tests performed, actually an increase from 11-12 to 12-13. Some of the increase was due to a national tuberculin shortage, where physicians that were giving PPD skin tests in their practices at one time decided, due to this shortage and the inability to receive the injections in a timely manner, to send their patients to the health district for testing. We were fortunate that we still received our allocation of supplies, since we have both state and federally funded TB grants. Also, due to a colder winter, we did have an increase in the number of TB skin tests that we administered to the homeless. We administered over 800 TB skin tests to the homeless this past year. Our largest increase, as noted, was from our jail population, though, and the detention centers, where all inmates are tested, since they are considered at high risk due to the close proximity living conditions. Moving down to the number of food service establishments, we see a decrease due to the economy, small mom and pop restaurants and mobile units that had to close down. So even though you see 250 new restaurants on the next line, in fiscal year 12-13, we still had more restaurants closed than opened. If you go down to the bottom of the page, we start out with the first mission element, which is to enforce health and safety code compliance. We aim to conduct at least 2,500 restaurant inspections on an annual basis. We currently have 7 inspectors to conduct restaurant inspections, swimming pool, septic system, certificate of occupancy, daycare inspections, foster home inspections, special event inspections, as well as conducting food handler classes, to name a few. We currently have conducted 2,350 inspections and are on target to meet this goal. As for the next measure, the percent of restaurant complaints responded to within 24 hours is low, but we had significant shortfalls last year that drove this number down. We reorganized in order to move our team to an automated and more efficient system, and at one time we were down 2/3 of our staff, which made it impossible to service those complaints in a timely manner, bringing our percentages down to near 30% last summer. We are now back up to 100% staffed in our inspectors, so our numbers are climbing, and we believe we will meet this measure soon since it is based on an average. Finally, I'm going to end with immunizations. I want to say that while we strive to be the best in Texas, there can only be one number one. But we do have areas that we excel in, such as immunizations. Immunizations is a major health indicator of how well your health department is doing in your community. Fortunately for us, we have an excellent immunization status for students who are completely vaccinated for public and private schools. This information comes from the 2012-13 annual report of immunization statuses, Texas Department of State Health Service Immunization Branch. The report looks at percent of students vaccinated against preventable diseases such as DTaP, hepatitis, MMR, polio, and varicella, better known as chickenpox. Texas is divided into 11 health regions, and we are part of Region 11. The region with the best percent of students completely vaccinated in 2012-13 for kindergarten students in each category that I just mentioned, the Tdap, the hepatitis A and B, MMR, and varicella, was Region 11, which includes our health district. Region 11 has Hidalgo County, Cameron County, Nueces County, and San Patricio County. For 7th grade students, we rank the highest as well in every category except polio. Polio, we rank second best at 99.3% completely vaccinated students. The top region for polio was 0.2% higher than us at 99.5% completion rate. This could not be accomplished without the help of all of our outstanding pediatricians and physicians in this community, but I also have to give our immunization staff a hand in their efforts in meeting this outstanding status. Vaccines are counted among the greatest public health achievement of the 20th century. Not only does the immunization clinic conduct health fairs throughout the year, they also have a large back-to-school immunization drive-through flu clinics, and audit all of the daycares in our community for vaccination compliance. Since some things that will impact what we look like in the future, the Affordable Care Act, the new rules for our immunization, Texas Vaccine for Children program, they do not allow us to vaccinate anyone that has insurance. As we all are aware, with the Affordable Care Act, everyone at some point should have insurance. So business as we know it will change. We are hearing that our immunization grant will be cut by 50% in the near future. Billing, we are learning how to bill for private insurance. That is something we currently do not do. We normally take Medicaid patients. So there are changes, but we are willing to be flexible to be able to stay up with the changes. Any questions?
What is your training the process, your plan for the insurance in the private sector as far as making some of those claims?
We've actually hired a billing company to actually help us with that because we bill for Medicaid, but we need to also learn how to bill for the insurance through the automated system that we have, since we recently switched over to an electronic medical record. So we're trying to interface the electronic medical record with the billing system.
What's the timing for that? And when do you think you'll actually start to be able to apply for reimbursements?
Well, we've actually already started in some areas. We're starting with one program, our STD program, and then we're trying to roll it out to the other programs. So we've already started that. We're just starting slowly. So we started with Blue Cross Blue Shield. We're looking at Humana. So there's certain areas that are easier for us than others, but with the Affordable Care Act, there's going to be a lot of different exchanges or insurances, and so we're trying to see how we can get on board, as well as other health departments are doing, to be able to bill for all of them.
Yeah, well, that's encouraging, and I would encourage to expedite it and fast track it, considering that you anticipate 50% reduction in your grants. That's certainly a big concern,
That is.
budgetary wise. Any other questions? Thank you, Ms. Rodriguez.
Thank you.
Mr. Olson?
That's all I have, Mayor. Thank you.